Sanju Verma is national spokesperson of the BJP. Adil Singh Boparai, spokesperson of the Congress Party. Dr. Nandkumar Jairam is the CEO and chairman of Columbia Asia Hospitals, and we'll also be joined by Dr. Muzaffar Lakdawala, who is the founder of Digestive Health Institute. Let me start with you, Sanju Verma. 6 states, not 1 or 2, but 6 states have written to the union government and also publicly said that they need vaccines urgently because they are running short. Surely not all of it can be, opposition propaganda or a make-believe myth, if you will.
Zaka, I just want to say one thing. First and foremost, let us acknowledge the fact that the Modi government has done an outstandingly stupendous job, be it with respect to reining in COVID or with respect to the mega vaccination drive. I am not saying that the states who've written to the health ministry need to be looked at with suspicion, but the fact remains that the entire vaccination process, Zaka, you have been doing various stories on this on your channel, is based on 3 things: availability, affordability and accessibility. And I think on all 3 fronts, the Modi government has deliberately adopted a calibrated approach, because given the sheer size of our population at 1.38 billion, we need to have calibration, which is the buzzword. And for those who say that there is shortage of vaccines, I also did some homework. I checked with the health ministry. Now, the interesting thing that I found out was that in the case of, say, Covishield, each vial has 10 dosages. Yeah. And if you don't finish the dosages within 4 hours of opening the vial, then, it basically is of no use. Correct. Because, the expiry date after opening is only 4 hours. And I was surprised that many states which are whining and complaining, when they open the vials, they ensured that, there was not even a critical mass, or rather they did not ensure that there was a critical mass of at least 10 people available, so that a vial of 10 dosages did not go waste. I'm surprised at the lackadaisical and criminal lethargy of the states. Just one point, Zaka. Maharashtra has been at the epicenter of the COVID problem. I myself, being from Mumbai, I can tell you, I have been visiting hospitals, both government and private, and it is not shortage of vaccines. It is shortage of critical mass of people. And the fact is, even today, what did Prakash Javadekar say? What did Rajesh Bhushan, the health secretary, say? He said we gave 1.06 crore vaccines. Yeah. And even today, Maharashtra has used only 88 lakh. Till last week, the usage rate in Maharashtra
I want to ask
Adil
Boparai. I want to ask Adil Boparai, and this is from the statement put out by the health minister, that Maharashtra has vaccinated only 86% of its health workers in the first jab and 41% in the second jab. Among senior citizens, Maharashtra has vaccinated just 25%. Punjab, the state that you come from, Adil, the first jab for health workers only 72%, second jab 41%, and senior citizens above 60, Punjab has vaccinated only 13%. So you can't blame the centre if the states concerned can't find enough people to vaccinate.
Well, Zaka, I hope I'll get the same duration of uninterrupted time as the BJP representative. My first point is that the vaccination policy of the central government is flawed. And one such state which is written to the center is the Haryana BJP government. Last I checked, there is a BJP government in Haryana. It is not a Congress government. Point number 1. Point number 2, there are 4 broad parameters on which this government has miserably failed. The first parameter is restricted access to vaccine. The second parameter is excessive wastage of vaccines, which comes to about 7%, which is the national average. The third is zero planning when it comes to vaccine logistics and supply chain. And the fourth is dilly-dallying on vaccines protocols. Now, the pertinent question, Zaka, which the country today is asking, is that why is India not diversifying its vaccination basket? When there are equally efficacious vaccines such as Pfizer, such as Moderna, such as Johnson & Johnson, why are we not allowing them to come and join the fray and enter the vaccination spree? Point number 1. Point number two, what we really need to focus is on ease to vaccination. If you look at countries like England, like United States, like Israel, all these are countries with a diversified vaccination basket. They're not just banking on one vaccine or two vaccines. Today, as we gather from what the health ministry said, there is a supply side issue. So if there is a supply side issue, why are you not allowing other global vaccines to enter? Because it is not that people between 18 to 45 are not catching the infection. In fact, there are people between 18 to 45 who are catching the infection and are passing it on to their elders.
I get that. I get that. But
Number two,
just on the
Zaka,
point.
I'm being interrupted.
No,
Zaka,
one second.
Zaka, this is
One
not-
second.
No,
Sanju, no, one second. This is
Zaka, this
no.
is not-
I will
interrupting.
give him time. I will give him time. But I just want to make one
be fair on
clarification.
this.
One clarification that the reason you talked about, the second point that you made, Adil. The point that we are not giving approvals to other vaccines. Well, in the case of Pfizer, for sure, I can say this because this is a matter of record. You can go and check that on 2 occasions at least, Pfizer was asked to appear before the SEC, which is the committee which gives the approval. Pfizer did not show up. Now, you can't possibly blame the government for that. In the case of other vaccines, I don't know. I don't know if they've applied. I don't know if the application has been rejected. I do know that Sputnik is under consideration. All right, no, Sanju, I'm giving you time.
If she interrupts me like this, we can't make a spectacle of a public health crisis. Please give me time.
Okay.
This is the
Quickly make your third point, and then I need to go to the doctors, please. Yes.
Please. When Pfizer had approached
Zaka,
us in
he's made
January,
many
the
points.
government of India...
I will come back to you
Zaka,
in
this
due
is
course,
unfair.
Sanju. I will come back to you in due course after the doctors.
In January, Pfizer had approached the government of India. The government of India declined. The problem today is there is acute shortage of vaccines. It is not just the Congress party. It is the BJP government from Haryana, which is also written. So therefore, Ms. Verma can use adjectives like whining, etc. The problem is Narendra Modi has misplaced priorities. He just wants to divide India. He doesn't want to come up with a comprehensive, calibrated policy.
Okay, I'm going to move away. I'm going to move away from both the political party spokespersons. One second, please pull back from both Adil and Sanju. I want to go to Dr. Lakdawala and to Dr. Jairam. Please tell us what is the situation on the ground. I'll start with Dr. Lakdawala because you're from Mumbai. You're part of the Maharashtra COVID task force. So please tell us, is it true that there is a serious shortage of vaccine in the city and in the state? Because the central government seems to give the impression that even the vials and the dosage that's been made available to Maharashtra has not been fully utilized. I think the exact figures are 1.06 crore were made available, and so far only 93 lakh have been expended or inoculated by the state government. So, Dr. Lakdawala, what is the situation on the ground?
Thank you, Zaka. Just to cut away from all the noise, we must understand this is a humanitarian crisis. It's not only that the states are struggling, it's the country that is struggling. We have the second largest number of COVID people. So yes, everybody does agree that we should vaccinate at the fastest pace. Vaccination will probably not get rid of this pandemic, but at least it will blunt the edge of this pandemic. Coming from that, the chief minister of the state went on a Facebook Live wherein he said we vaccinate 3 lakh people a day. We have the capacity to vaccinate up 7 lakh people a day. We have vaccinated, like you said, 83 lakh people out of 1 crore 3. Now, it's only 20 lakh vaccines that are available now. How many more, if they just distributed among the states of Maharashtra, they won't be left with too many vaccines, I believe. And that's what the health minister said, that we've got stock of only 3 days left. I don't know about the legalities or the actual position on ground, but all I can say is, let's open it up. Let's give people, let's not get into someone who's not taken. For example, you said healthcare workers didn't take the second shot or old age people didn't take. Let's give it to the people who are willing to take it, is all I'm saying. Because the more people we can vaccinate, we'll probably get lesser ICU admissions, lesser hospitalizations, lesser severe patients. The game is here. We'll have to learn how to live with COVID. The game, let's lose less Indian.
Okay, so the game is to try and learn how to live with COVID. We are not going to be able to vaccinate entire populations because, let's face it, I mean, we're a 1 billion plus population. So if you're looking at herd immunity of 60 or 70%, you're looking at 60, 70 crore people. That's going to take a long time. Dr. Jairam, you represent a chain of hospitals predominantly in Bangalore, but also in the rest of the southern part. You tell us, what is the situation that you're facing? Is it a lack of vaccines or a shortage of vaccines, or is it that you're not able to find enough people to even expend the current dosage?
We've never had a shortage of vaccines, Zaka, and that I can place on record with no hesitation that we've had enough vaccines and vaccination opportunities in all our Bangalore hospitals, as well as in the other hospitals that we have across the country. What I'd say is that the initial enthusiasm amongst the senior citizens to get vaccinated was substantially high. But then over a period of time, it kind of slowed down. And now you can walk in and get a vaccine any day from any of our hospitals. I would say that we are in good shape as far as vaccines are concerned.
Okay.
And just to place on record, the Serum Institute is capable of producing 5 crore vials of vaccine, 5 crore doses of vaccine in a month.
Mm-hmm.
And they are planning to ramp up to 10 crores. So if you combine that with Covaxin, then I don't believe that there is a shortage of vaccine at all. And
Okay.
let's also understand that the target percentage of people to be vaccinated is 35.7 crores. And one must understand that this number is the vulnerable population, and the effect of the vaccine is not to prevent you from getting the disease,
Okay.
but to reduce the severity of the disease.
Absolutely.
And prevent death, in fact, bring the death rate down to 0.
No, that I
And if you
agree.
look
That
at
I
all-
agree. In fact, I think we spoke to Adar Poonawalla yesterday, and he said this very clearly. This is not a vest that's going to protect you from COVID. It's not like a bulletproof vest. It's going to block the virus away from your body. What it can do is ensure that if you have taken the vaccine, you don't have to go to hospital. The seriousness of the illness that you get will not be as much than if you do not have the vaccine. Let me play out that sound bite, because he's also talked about if we are to go at this current rate, then we will need to manufacture much, much more if we were to vaccinate 20 lakh, 30 lakh, close to 40 lakh people every single day. So I want to play out a small, very small excerpt, 20 seconds of what Adar said to us, and then I'll go back to Sanju Verma.
They'll come to a point where you can't vaccinate more than 2 or 3 million people per day because of the sheer capacity that currently exists in the country of vaccine manufacturing. So the government is working, very closely with vaccine producers like Serum Institute and many others to see how they can financially aid and find other innovative ways of how to ramp up our capacity. We are even looking at collaborating with others if that need arises.
So, Sanju, you've heard what he's saying. He's one of the 2 manufacturers whose vaccines has been approved in
Yes.
India. He's saying we'll have to find ways to ramp up production. Otherwise, we won't be able to inoculate 2, 3, 4 million people every single day.
You know, Zaka, first of all, yes, that interview by Adar Poonawalla was very revelatory in many ways. Thank you for playing that bite out. I just want to say one thing, Zaka. The Congress spokespersons can come here and be the proverbial ostrich with their head buried under the sand, blame the Modi government for anything. That's what they've been doing, and losing one election after another. They never seem to learn from past mistakes. Let us isolate the problem. What I find very worrisome is the fact that there is a generic narrative. Oh, there's a shortage of vaccine. Oh, India's recovery rate has fallen from 97% to 92%. Though the fact remains our recovery rate at 92.32 is still amongst the best in the world. Our fatality rate at 1.3 is still the best in the world. Our cumulative positivity rate at 5.07% is still the lowest in the world, despite the fact that out of 10 severely hit COVID regions, 8 come from Maharashtra, 1 is from Bengaluru, and 1 is from Delhi. So clearly, Maharashtra needs to take disproportionate onus of the manner in which the COVID monitoring has simply gone haywire, thanks to the Maha Vasuli Agadi, of which the Congress is a very honorable part of. Let me tell you, be it the weekly positivity rate, which is at 23.2% in Maharashtra and 13.8% in Chandigarh, be it the fact that the usage rate is the lowest and the wastage rate is the highest in Maharashtra, there are 1 or 2 states who need to get their act together. And we need to isolate the problem and ask for accountability from people
what about
who are
states? What about states that are not
Maharashtra?
Maharashtra? There have been 5 other states that have flagged this issue.
Punjab and Maharashtra.
No, no. Odisha has, Chhattisgarh